If you have been living with a burning sensation in your chest after eating, struggling to get comfortable when you lie down, or finding yourself awake in the middle of the night because of that familiar discomfort, I want you to know that what you are experiencing is real. You are not overreacting, and you certainly are not alone. Millions of people deal with these symptoms every day, often believing they simply have to live with them. Before we go any further, however, there is something extremely important to understand. Not every pain in the chest is caused by acid reflux. If your discomfort feels like crushing pressure, squeezing, or heaviness, especially if it spreads into your arm, shoulder, jaw, neck, or back, particularly during physical activity, treat it as a medical emergency. Seek immediate emergency care without delay. The burning discomfort we're discussing today is different, and understanding that distinction could protect both your health and your life. Many people reach for an antacid, wait for the burning to settle, and assume the problem has been solved. Unfortunately, that temporary relief often hides a much larger issue developing beneath the surface. The burning may disappear for a while, but the reason it keeps returning is because the underlying cause has never truly been addressed. Simply calming the symptoms is very different from correcting what is happening inside your digestive system. Here at Vital Aging, our goal is to help you understand your body in clear, everyday language so you can make informed decisions about your health. Today, you'll discover the important differences between heartburn, acid reflux, and GERD, three terms that are commonly used as though they mean the same thing, even though they describe very different things. You'll also learn why these problems often become much more common after the age of 50, and why certain unexpected symptoms, which many people never connect to their stomach, may actually be warning signs that acid reflux has been affecting the body for much longer than they realized. Understanding these differences is the first step toward lasting relief, instead of temporary fixes. To understand what is happening inside your body, it helps to separate three terms that are often confused. Although people casually use heartburn, acid reflux, and GERD as if they all describe the same condition, each one refers to something different. Knowing the distinction can completely change the way you approach treatment and long-term health. Let's begin with acid reflux. This is the actual physical event taking place inside your digestive system. Your stomach naturally produces powerful acid every day because it is essential for breaking food down and helping your body absorb nutrients. The stomach is specially designed to handle this acid, with a thick protective lining that shields it from damage. Your esophagus, however, has no such protection. It is simply a passageway that carries food from your mouth into your stomach. One of the biggest changes that occurs as we grow older involves a small but incredibly important muscle called the lower esophageal sphincter. This ring of muscle acts like a one-way valve between the esophagus and the stomach, helping to keep stomach acid where it belongs. As we age, however, this muscle naturally begins to lose some of its strength and firmness. It may no longer close as tightly or consistently as it once did, making it much easier for stomach acid to travel upward into the esophagus. At the same time, another age-related change is taking place. The stomach often empties more slowly than it did in younger years. When food and stomach acid remain in the stomach for longer periods, there is more opportunity for pressure to build and for acid to move in the wrong direction. This combination of a weaker valve and slower digestion explains why so many adults notice that reflux becomes more frequent or more severe after the age of 50. There is another factor that surprises many people. Certain medications, commonly prescribed for conditions such as high blood pressure and heart disease, can also contribute to reflux. Some blood pressure medications, including calcium channel blockers, nitrates, ACE inhibitors, and even certain cholesterol-lowering medications, may relax smooth muscle throughout the body. While these medications are often essential and should never be stopped without medical guidance, they can also relax the lower esophageal sphincter, making it easier for acid to escape into the esophagus. Another common condition worth knowing about is a hiatal hernia. This occurs when a portion of the stomach pushes upward through the diaphragm, changing the normal position of the lower esophageal sphincter. As a result, the valve becomes less effective at preventing reflux.
Hiatal hernias are especially common in older adults, and many people have one without realizing it until it is discovered during an upper endoscopy. Fortunately, once these contributing factors are identified, they can often be managed effectively with the right combination of lifestyle changes, medical guidance, and appropriate treatment. There is another side of acid reflux that many people never hear about, and it often leads to years of confusion. Most people assume that GERD only causes a burning sensation in the chest, but stomach acid can affect much more than the esophagus. In fact, some of its most common symptoms appear to have nothing at all to do with digestion, which is why they are so frequently overlooked. Have you ever felt as though something was stuck in your throat, even though swallowing was completely normal? That sensation has a medical name called globus sensation, and it is often linked to irritation from acid, rather than a problem in the throat itself. Likewise, a persistent cough that refuses to go away may not always be caused by allergies, a cold, or a lung condition. During sleep, tiny amounts of stomach acid can travel high enough to irritate the upper airway, triggering a chronic cough